Jimmy. I think you all know now that our guest coming up for our CompU interview is Jimmy Johnson. I want to make sure I have the recording going. It says pause stop. Okay, I guess it's going. Okay, Jimmy Johnson is the project coordinator for the Southern Regional Office of the Retired and Senior Volunteer Program, serving Brazoria, Fort Bend, Matagorda, and Wharton counties. RSVP.
That's right.
The Respondez s'il vous plaît that Janice talked about in class on Monday. But RSVP is America's largest volunteer network with over 450,000 volunteers across the country. Now, RSVP does many things that Jimmy will be telling us about. It does help children through early childhood development programs that you might have heard of, some things with Head Start and things like that. Families with emergency food programs, communities with the disaster relief programs, and I believe you might have been involved in that too, down in Angleton, Jimmy. But what I'd really like to know about is, how does RSVP help the elderly and disabled people?
All right, you're ready for me.
Yes, I am.
All right, thank you very much. Yeah, I'm glad to be here with you. We are really a support organization for nonprofit organizations. So it's really interesting. Everything that we do is simply support the volunteers, and we help find volunteers, we help support the volunteers, but we don't do the direct work that the nonprofit organizations do. So an organization, say like the Gathering Place, we don't tell the volunteers how to operate within the Gathering Place or where they have to volunteer, or that's all left up to the organization, to the Gathering Place. So we are support system for those volunteers. So it's kind of interesting. So we don't have a direct correlation like with the clients that the Gathering Place has. We don't directly work with those clients, but we help the volunteers that do work with those clients. So we're kind of a step out of the direct involvement of working with clients or different organizations. So it's kind of an interesting relationship, but it's a good relationship. The RSVP has been around since 1971. It was actually formed and started by the U.S. Congress. I know one of the things that we were going to talk about is funding, and we get government grants, but that's not our only funding. We're also funded with the United Way. We get funding from them. We have some private donations that come in that support RSVP. So we get funding from different places, but probably our main support comes from government grants. So it's kind of an interesting thing. My boss is Walt McFadden. Walt's been around for a while, and running our organization. And he'll always tell you, take advantage of things like this because it's your tax dollars. It's our tax dollars. So, a lot of times we don't get direct benefit from our tax dollars. When they go to the government, they're gone. They go to other things, other places. We never see it. This is one of those opportunities that our tax dollars are actually coming back to help benefit us and benefit you and different organizations. So it's a nice way to use our tax dollars and help benefit you.
Excuse me. Does RSVP match volunteers for home delivered meals for seniors, or
we do? That's one of the that's one of the things we do. We're really involved in Meals on Wheels, and part of what we do with organizations is help provide mileage reimbursement. So those that are delivering the meals can actually get a reimbursement, so it helps with their gas expenses. So it's not so expensive. It's not coming out of their pocket when they're delivering meals through Meals on Wheels. So that's another way that we do help and benefit volunteers.
So it's would you say it's a government organization, but not a government agency?
You know, that's probably a good way to put it. It's really the relationship's interesting. CNCS is the government organization, and they have, like, the directors actually chosen by the president, not by the president. It's one of those positions, and then they actually direct RSVP nationwide. It's there are other organizations that they deal with, but RSVP is one of those. The names have changed lately. It's kind of interesting. It was Senior Corps for years and years, since 1971. They've now changed that to AmeriCorps Seniors, which is interesting because AmeriCorps has been around as well for a long time. AmeriCorps is the volunteer organization for those 55 and younger. Senior Corps was the volunteer organization for those 55 and older. So now our name is AmeriCorps Senior instead of just Senior Corps.
Did it merge?
No, not. It's always been together. That CNCS has always been over both of those organizations. But it's just a name change. It really hasn't changed anything else but the name.
What does CNCS stand for? I'm not familiar with that.
It's you have to ask. You're putting me on the spot there.
Sorry. Maybe they will know. Okay.
One of those government organizations that
it's the corporation for blah 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 blah.
I know. I know. It's one of those. It's just easier to call it CNCS than try to remember what it's been.
Does RSVP work with Medicare in any way?
No, we don't. We don't.
And how about senior education programs? Are you involved in that?
We do. We have several different things. In fact, here recently, before the COVID virus hit, we were starting a new program for opioid education, trying to help train and let people know about opioids and the dangers of opioids. And but that's kind of been put on hold with COVID, but we're going to get back to that. But we do things like that, where we try to provide education. We also work with the Better Business Bureau of Houston, SMP, Senior Medicare Patrol. And we try to give out information, provide information training about Medicare and about scams. Basically is the big thing that's that SMP does, is kind of warn people of the different scams that are out there. So we work with them as well, and try to do some training in that way.
Okay. What does RSVP do in addition to the gathering place to help caregivers or people with Alzheimer's or dementia?
It depends upon the organization. Again, we don't directly deal with the clients, but we do help support organizations that do that. We deal with a lot of food pantries. We deal with a lot of senior centers that provide congregate meals and different programs like Actions, if you're familiar with Actions, and Angleton. We work with them. So we're a support group for the volunteers, and we don't necessarily do the direct work. That's left up to the organizations to do.
Okay, but just the same, RSVP is very involved in emergency food and disaster relief services, I believe, and things.
We are. Yeah, again, it depends upon. We work with a lot of different nonprofits. Homeland Preparation out of Angleton, they do a lot of emergency preparation in Brazoria County and Fort Bend County, and we work with them. But we work our organization, RSVP, is nationwide, but the one that I work with, our home office is in Houston, and we cover 18 counties. So we go from College Station all the way down to the coast, down to Freeport. We do not cover anything in Galveston, but again, I cover back over to Matagorda and Wharton County, So it's a broad area. It's a big area that we cover, and there's all the emergency preparedness groups in all of those counties that we deal with and work with. So we do a lot with that.
So you work with the hurricane preparedness education and groups and things like that. Did you have something like that for our recent freeze also?
We actually did. We have a number of volunteers, well, with the freeze, and then also with the COVID virus. We've had a number of volunteers through Homeland Preparedness that where they were doing the drive-through. They had volunteers that would help with that. So yeah, we've been involved in anytime there's an emergency like that. We kind of have some volunteers somewhere that are involved in that.
Sounds like a lot of people to coordinate. What are the benefits of volunteerism?
Oh my goodness, that the one thing and the reason I think like that RSVP was set up was because they wanted to make sure as people retired, they didn't just go home, sit on the couch and watch TV all the time, because it's proven that if once a person retires, if they stay active, it helps physically, it helps mentally, just everything about it. And being a volunteer helps that person not just to live a shorter life, it actually can help extend a life just because of being involved with other people. And the one thing I always hear with people that volunteer is that they say, I get more out of it than I know the people I volunteer for.
That's right.
That you hear that over and over again. And I
Good
think
way
that's very
to
true.
make new friends and stretch your horizons a little bit. But have you heard of a study that showed that volunteering helps you live longer
Yes,
because of the health benefits, I guess?
because of the health benefits, because you're moving and involved, and as opposed to being sedentary and sitting on the couch or not doing anything at home. Absolutely, it's got some great physical benefits.
Why would you recommend someone volunteer through RSVP instead of through their own personal favorite organization?
Yeah, and they can do either way, but probably the biggest benefit with RSVP is the supplemental insurance that we provide. We provide that for every RSVP member, no charge. It's just part of what we do to support them. And it's a really kind of a nice thing. It's supplemental insurance that helps while they're volunteering, and includes life insurance, accident insurance. It even includes car, dental, eyeglasses. And one of the things that Brenda could take, the one thing I think that when we started our relationship with the Gathering Place was the insurance, but there's a $1 million liability policy as a part of that. And that's one of those things you don't think about, but it's very beneficial. And that simply does, if you're helping with someone and something were to happen and there was an accident, and there are now people that want to sue when something like that happens. And the insurance that we provide is $1 million liability that protects the volunteer, but it also protects the organization, the nonprofit organization, gives them some coverage to help protect if someone just wants to sue because someone got hurt and they think it was their fault.
That's right.
So yeah. So it's really a great benefit. And again, it's no cost at all to the volunteer or the organization. We provide that. It's estimated that cost is probably around $300 to $350 a year per volunteer. So that's, again, a nice benefit for them that helps protect. And it's a kind of almost a thank you for volunteering, that you're going to volunteer. We're going to help you out and make sure that you're covered and protected while you volunteer.
Is there a minimum number of hours or other requirements for the volunteer to be insured?
The one minimum is 1 hour a year to volunteer.
Wow, that's nothing.
That's it.
That's 2 phone calls,
That's right.
on a group or something.
So as long as they volunteer somewhere within that year, then they're considered RSVP member. So that's the only minimum. There are other organizations. There's groups that have stipends, but they do like 20 hours a week, or, there are other requirements like that. For some people, that's difficult to do. So the 1 hour a year is simple and easy for anyone to do that and fulfill that.
You
But,
mentioned car insurance. If
uh-huh.
a volunteer is driving, say, to go volunteer at a gathering place or brain fair, and they have a car accident, will RSVP pay their deductible?
It depends. What they'll do with supplemental insurance is they go to your primary insurance first. So that's one of those issues. I'm not sure, how much, if the deductible will be covered, but if there are other out-of-pocket expenses, then it helps with those. But it goes to your primary car insurance first. And again, if there's, some shortcoming there as far as that policy, then that's when the policy kicks in and helps out with that. So it's kind of, I'm not real sure on that, because I asked, and I don't think I've ever heard a good answer on that one.
See,
But it is, as far as the help, it's additional coverage for them.
Very good, very good. And you said that the government does pay for this, but you also receive grants from organizations such as United Way. Do you get county grants also for Missouri?
No, we don't get any county grants. Our main office is at the Jewish Community Center in Houston. They're our sponsor, so we do get some funding. They help in ways too at the Jewish Community Center, and then again United Way, and then there's some individuals that give donations and support it. But again, the main funding comes from the government grants.
How does somebody get started with RSVP? Do they have to fill out an application or call you, or how is that done?
Either way, and there is an application. Some organization, it's been good. The gathering place is a great model of how it should be done, and that is everybody that is in the gathering place that's 55 or older is automatically signed up for RSVP. Some other organizations do it differently, and it's more of a, some people will want to do it, some people don't want to do it. It just really depends upon the organization, the nonprofit. But the way we do it with the gathering place is really good. Everybody has to fill out an application. And that application, it's, we don't sell information, a mailing list. That information is locked up in a file cabinet in Houston. And it's very, very closely watched as far as no one's able to access that information. So we're real good about protecting the information that's there, but we have to have some information. And of course, with the insurance, with the life insurance benefit, there has to be someone's name if something happens, a contact. So we have to get information like that.
Very good. I understand that you've lived a life of service. Can you tell us about the ministries other than RSVP that you've been involved in?
Sure. Yeah. I was a minister in Baptist churches for about 25 years. I was a business administrator and a minister of education. So I've been involved in churches for a number of years. I've worked mostly just nonprofits. Even after I worked with churches, I was an administrator at a camp and conference center for about 8 years, which was a nonprofit organization. And we had a place for churches and groups to go for retreats. And it was really kind of a nice deal for churches and groups. But yeah, I've been involved in that for a lot of years, different ways with nonprofits, and really enjoyed it. And always have enjoyed working with people and helping people and doing whatever I can.
Yeah, very good. Were you involved with, I want to say, Living Waters Ministry? Are you familiar with that? I was reading about Jim Johnson with that, and I thought, well, I'll just ask if that was you.
No, that was someone else. I've heard of Living Water.
Okay.
But I've never worked with that organization.
Very good, very good. Do you live in Angleton now?
I live in Lake Jackson.
In Lake Jackson. Does your father live, you live with you?
Yes, I live with my father, who's 92. I'm a caretaker as well.
This one is 92 also,
Yeah,
almost.
yeah.
Very good.
So
So are you the primary caregiver for your father?
I guess I'd be considered the primary caretaker. We do have, we work with caring seniors in Lake Jackson. And so there's a lady that comes and stays with my dad, of course, while I work. And I also, I do dialysis as well. I do that 3 times a week. So that's about a 4-hour block every time I go there. So we have a lady that comes and helps out with my dad while I'm not here.
Have
So,
you
but
had your father for many years?
I've been here, yeah, probably about 7 or 8 years now.
He's been with you that long?
Yeah, yeah. But I've been helping out with him, and he does pretty well. He's slowing down a little bit, but he's done pretty well in the past.
And so you have like home health or somebody who can relieve you while you go out and do your other needs?
Right.
Very good.
That's correct. Yeah. So that helps out quite a bit. But
Were you on a special list to keep power during the freeze because of your father's condition?
We've signed up for everything. We've never had to use anything, or with the freeze, it was like I said, we had power and water the entire time.
Oh,
We were
wow.
very
Wow.
fortunate.
I wish
Yeah.
you did, because that was very difficult.
Yes, it
Yeah.
was.
We've never had to use those kind of things, but we sign up for all the lists, and if we needed to, we could. But we've been very fortunate with that.
Very blessed. Do you have any hobbies or lifestyle choices you'd be willing to share with us about you, Jimmy Johnson, personally?
Probably the main thing that I've really been doing now for several years. I work out every day, and I have really enjoyed that. Yeah, I go to the gym every day, and part of that was when I started dialysis. I got on the transplant list, and I made up in my mind, if I'm going to have a transplant at some point, I'm going to be physically fit, so that when I go through that process, it won't be near as hard to recover from it. So that's been part of my motivation, and it really has helped a lot. It's amazing the difference, things like blood pressure, and one time I was taking 5 blood pressure medications.
Oh,
I've no longer had to take those, and that's just because of I think the working out, and I'm on a treadmill every day for about between 2 and 2.5 miles every day, and I lift weights before I do that, and so that I enjoy it though. That's been the amazing thing. I think it's something that I really do like to do.
do you eat a special diet also?
I have to watch what I eat, but I'm fortunate. There are some, of course, on dialysis that have a real strict diet because of their condition. My condition is kind of interesting. It was all because of a staph infection, and I was in hospital for 6 weeks getting antibiotics, and all the antibiotics damaged my kidneys. So there are many though that are on dialysis that have diabetes and other problems that I don't have, and that's really been easier for me to deal with it because of that. And even though, yeah, I watch my diet, watch what I eat, but it's not a real strict diet. The big thing are fluids. Just being careful on how much fluid. You're supposed to be limited to 32 ounces a day, and I drink less than that usually. But that's probably the main thing over diet is the fluids that you intake.
Has kidney disease interfered with your volunteer work, or is this just another part of your life? Or?
For me, it's just another part. In fact, I tell people when I go to dialysis, you sit there and take a nap, or they have TVs at each station, or you take your phone and listen to music, or it's really just a kind of a period to take a break from everything else and kind of relax and rest for a while.
So no, read a book or something like that.
Absolutely. Yeah.
So it's not
anything like
time then.
Yeah. No, it's a really kind of a, like I said, it's a restful time. It's that, and I don't, of course, I don't take any phone calls or anything like that while I'm there. I could talk to people if I want, but it's really just a time to kind of get away from everything. But it hasn't interfered at all, really. That's been pretty amazing to me. But again, I feel very fortunate, and I just do really anything else that I want to do.
It's very uplifting to hear you say that this, even though you have this condition, you haven't let it interfere with your mental health, with your spirit. You've turned what many of us would see as a negative into a very positive, uplifting time for you. And I'm so grateful you shared that with us. And
Well, thank you.
so much for joining us today. It's so good to see you. I normally only see you once a year at the RSVP
That's right.
recognition dinner, but that hasn't been held because of the pandemic. So
That's right.
maybe someday
Thank you,
we'll be in
Jimmy.
person again. And thanks again for joining us.
Well,
Thank
thank you.
you.
Thank you. It's good to see
We'll see you
everyone.
at the brain fair, won't we?
Absolutely. I
Yes.
will be there.
He's all
Good.
registered and ready.
That's right.